Than 10,000 confirmed cases of COVID-19 and more than 400 deaths in our state. Our country, nearly 215,000 cases and more than 4,500 deaths, according to the CDC. And yet it feels like we hardly ever hear about recovery rates. Well, local doctors say around 9 in 10 people are going to recover just fine.
About 10% of people who get the coronavirus seem to have a pretty stormy course, and they develop a pretty rapid deterioration over the first 4 to 6 days. About half of those patients, or 5% of the total, will end up proceeding on to dying.
Dr. Norman Chapin is the chief medical officer of McLaren Bay and Thumb region. He says even when patients are put on a ventilator, they can recover. But what to watch out for is when the virus becomes more than respiratory and affects the heart, renal system, and liver.
So we're seeing what looks like a multi-system organ failure picture, very similar to what you would see in bacterial sepsis. It's a very bad sign, and the survival rate in that group of patients is much lower.
Dr. Chapin says the numbers are constantly changing. We still don't know exactly how deadly COVID-19 is.
So we know that the mortality rate, depending on what source you're using, somewhere between 2% and 6 to 8%. We're hampered a little bit to have a very accurate picture of the mortality rate because the level of testing has varied so much from country to country and from state to state in the U.S.
And our testing is still mainly being done on hospitalized patients, skewing the mortality data.
The true answer we probably won't know until the testing that is becoming available by commercial labs is really in full swing.
Scott Walczek, WNEM, TV5.